Hello and welcome. Today, we're shedding light on a serious eye condition called retinal vasculitis. This inflammation of the retinal blood vessels can have significant consequences for vision, so let's dive in to understand what it is, why it happens, and what can be done about it. Prepare to learn about the intricate world of retinal vasculature and the challenges posed by vasculitis. Retinal vasculitis isn't a disease in itself, but rather a sign of an underlying problem. Think of it as an alarm bell going off in your eye. The causes are diverse, ranging from infections like herpes, syphilis, or Lyme disease, to autoimmune disorders such as lupus, Behçet's disease, and sarcoidosis. In some cases, the cause remains unknown, classified as idiopathic retinal vasculitis. Certain medications and even cancers can also trigger this condition. Finding the root cause is paramount for effective treatment. Let's talk about what's happening inside the eye. In retinal vasculitis, the walls of the retinal blood vessels become inflamed. This inflammation damages the vessels, making them leaky. This leakage can lead to swelling, or edema, in the retina. Inflammatory cells can also infiltrate the retinal tissue. The compromised blood flow can cause ischemia, a lack of oxygen to the retina, which can, in turn, stimulate the growth of new, but often fragile and leaky, blood vessels, a process called neovascularization. These changes disrupt normal retinal function, leading to visual disturbances. Understanding how often retinal vasculitis occurs is difficult, as it's often linked to other systemic conditions. Its precise prevalence is challenging to determine due to the varying underlying causes and the fact that it may be underdiagnosed. It affects people of all ages, but certain underlying conditions, such as those we mentioned earlier, might predispose individuals to developing retinal vasculitis. Research is ongoing to better understand its occurrence and risk factors within different populations. The symptoms of retinal vasculitis can vary depending on the severity and location of the inflammation. Common symptoms include blurred vision, floaters, those little specks or strands that drift across your field of vision, and decreased visual acuity. Some individuals may experience pain, though this is less common. The onset of symptoms can be gradual or sudden. It's crucial to seek immediate medical attention if you experience any sudden changes in your vision, as early diagnosis and treatment are critical. Diagnosing retinal vasculitis involves a comprehensive eye exam. An ophthalmologist will examine the retina using instruments like an ophthalmoscope. Fluorescein angiography, where a dye is injected into the bloodstream and images are taken of the retinal vessels, is a key diagnostic tool to visualize the inflamed and leaking vessels. Optical coherence tomography, or OCT, provides detailed images of the retinal layers, helping to identify swelling and other structural changes. In addition, blood tests and imaging studies may be necessary to identify any underlying systemic conditions contributing to the vasculitis. The goal is to pinpoint the specific cause to guide treatment. While retinal vasculitis is not typically classified into distinct types, it's helpful to categorize it based on the pattern of inflammation observed. It can be categorized as primarily affecting the arteries, the veins, or both. It can also be classified based on its location within the retina, such as peripheral or central retinal vasculitis. Additionally, it can be categorized based on the underlying cause, such as infectious, autoimmune, or idiopathic. The primary goal of treatment is to control the inflammation and address the underlying cause. Corticosteroids, either as eye drops, injections, or oral medications, are often used to reduce inflammation. Immunosuppressant medications may be necessary in cases associated with autoimmune disorders. If an infection is the cause, appropriate antibiotics or antiviral medications will be prescribed. In cases of neovascularization, laser photocoagulation or intravitreal injections of anti-VEGF medications may be used to prevent further damage. Regular monitoring is crucial to assess the effectiveness of treatment and to watch for any potential side effects. Unfortunately, there's no guaranteed way to completely prevent retinal vasculitis, especially when it's linked to underlying systemic conditions. However, managing any known autoimmune disorders or infections effectively can reduce the risk. Regular eye exams are essential, especially for individuals with risk factors, such as autoimmune diseases. Early detection and treatment of underlying conditions can help prevent or minimize the impact of retinal vasculitis. The prognosis for retinal vasculitis varies depending on the underlying cause, the severity of the inflammation, and the promptness of treatment. Early diagnosis and effective management can often stabilize vision and prevent further damage. However, in some cases, retinal vasculitis can lead to permanent vision loss due to complications like retinal detachment, neovascular glaucoma, or macular edema. Ongoing research is focused on developing new and more effective treatments, including targeted therapies and immunomodulatory agents, to improve visual outcomes for individuals with this challenging condition. Thank you for joining us in learning more about retinal vasculitis.